All right. My name is Bill Stoops. I'm the faculty director of the Clinical Research Support Office, or the CRSO, and I'm happy to provide you a CRSO overview along with our executive director, Jessica Heskell. So the CRSO scope, we oversee all studies that are defined that meet the NIH definition of clinical trials, regardless of who is funding them, and any studies that will use UK healthcare facilities or services. Briefly, any studies that fall under that scope must be entered into our clinical trial management system, or CTMS, which is called ENCORE. If you are doing oncology-related work, Markey Cancer Center, abbreviated there as MCC, has additional requirements per NCI guidelines. If you're unfamiliar with those, we would refer you to the CRO in Markey Cancer Center. Any studies that utilize UK healthcare facilities or services must also be in EPIC, and our CRSO team will help you do that. We have a mission as the CRSO to help all investigators and study teams who conduct NIH-defined clinical trials across campus. So we have a cross-campus mission to help people with compliance, cost reimbursement, data management for their participants, and development and application of best practices. Our vision is to enable innovative therapeutics to improve patient care. And here's our org chart. I will not go over this in too much depth, but I want to point out that we have multiple reporting relationships and partnerships. The CRSO, like I said, is overseen by myself and our executive director, Jessica Heskell. We've got partnerships with the Center for Clinical and Translational Science. We report directly to the Office of the Vice President for Research, but also have partnerships with the College of Medicine and UK Healthcare. And Jessica's going to tell you about the additional details of the CRSO.
Great, thank you. So the CRSO manages ENCORE, as Dr. Stoops mentioned. ENCORE is the institution's clinical trial management system. So all NIH-defined clinical trials and any study utilizing UK healthcare services is required to be managed in ENCORE. So ENCORE is integrated with the EPIC medical record system to manage patient demographic information and billing for healthcare services. The CRSO provides a mix of required and optional services. The required services include building calendars in ENCORE, performing a coverage analysis if it is needed. We do some EIF budget reviews to ensure that those match the coverage analysis, as well as some other reporting and training requirements. The CRSO provides some optional services in collaboration with the CCTS on a fee-for-service basis, including clinical trial financial support, both pre and post-award. So the medical coverage analysis process reviews the study's schedule of events against national and state Medicare coverage rules to determine the likelihood of insurance paying for all of the specific procedures. The coverage analysis is a critical risk management tool for all of our clinical trials. So that analysis is then used as a tool to develop the study budget and to assist with charge review and segregation when a study is up and running. So these processes ensure that the federal laws and regulations about billing patient care charges in clinical trials are followed. The CRSO also assists with clinical trial accounts receivable tracking and reporting. So quarterly, the CRSO finance team works with Research Financial Services, or RFS, to update reporting on all unpaid invoices from industry sponsors. So our finance team will reach out to you for any required backup documentation during those reviews. And if you have any questions about the CRSO clinical trials here at UK or the services that are provided, please contact me or our team. The slides attached to this presentation contain all our contact information in the appendix and has a link to our website where you can find additional training and tools. Thank you and welcome to the University of Kentucky.